which have been undertaken in South Africa thus far. Thank you so much for joining us, Dr. Mabaso.
Thank you for having me. Lovely to be here.
We're also very honored to welcome Dr. Mark Wegerif. He's a lecturer in development studies at the University of Pretoria, and his research focuses on agrarian transformation and food systems. Great to have you with us as well, Dr. Wegerif.
Thanks for having me, and you can call me Mark if that's easier.
Thank you.
We're looking forward to a very interactive discussion. We promise we won't bore you to death by PowerPoint today. And if you are joining us via Zoom, please use the option. You can chat to us as well. There's an option to post your questions and statements to all of our panelists, and any of them, please just write their name or direct it to a specific panelist in that platform. And if you are joining us via one of Food For Mzansi's platforms, please comment on Facebook. You can simply tag Food For Mzansi and FairPlay on Twitter as well. Okay, so let's kick off today's conversation. I now give over to Francois Bird, the founder of the FairPlay movement.
Thank you, Dawn. Well, it's high time to have this conversation, and people may well say, why would FairPlay, as trade activists, be so concerned about child stunting, which is normally seen as a health problem? I wouldn't have been able to make this connection when we first started out on the FairPlay journey 4 years ago. But you know what struck me then, and what motivated us to start FairPlay, was when we saw the devastation caused by poultry operations in rural areas closing down. And when we realized that they closed down because chicken is dumped in South Africa by international operators selling it below the price of local production or the local market price, not really passing on the full benefit to local consumers, producers. And you know who went to the wall first? Small farmers and those people whose jobs were on the lowest rung of the job ladder. And they lost their jobs. And this is mostly in rural areas where unemployment is much higher than the national average of 30% now. And all the negative indicators increased when that happened. So we started on this journey of fighting for a better trade regime being exercised to stop dumping. Little did I know then, as I know now after being educated by people like Dr. Mabaso and Dr. Wegerif, that in fact the social cost of dumping is children whose lives are destroyed forever by stunting. And the worst is, it's a condition that can be prevented, but is very rarely cured. And that just grabs my heart. I just don't know how we allow that. So for me, this is a major national shame, but it's not yet a national focus. And my hope is that today that starts changing around, because tomorrow is World Children's Day. And I would really not like to listen to all the pious statements by important people about how important children are for the future unless we solve stunting. So I thank you, Food For Mzansi, Ivor and Dawn. I thank you, Dr. Mabaso and Dr. Wegerif, for joining us today to hopefully trigger some dormant feeling in the national conscience that we should do something about this. And I believe the outcome of this might be that we can show the way, what should be done. And I hope that's what we get to.
And Francois, I'm hoping that it will be more than a national conversation. This is a national emergency. Every child should matter in this country. Dr. Kupano, maybe as a way of introduction, just sketch how big the problem of stunting is in South Africa.
Sure, Ivor. So thanks once again for having me, and perhaps even just to take a step back and share a little bit about who we are as Growgate and what we launched in mid-2018 in response to the South African Demographic Health Survey that's shown that stunting in South Africa has persisted the same high levels that it's at now for at least the last two decades. And as many of you will already be aware, that this is a condition that results in children being excessively short for their age as a result of prolonged undernutrition and pregnancy in the early years of life. And why it's important, I mean, we don't care so much about height, but what we do care about is that this impairs not only the physical development of children, but their brain development as well, which is a gross wastage of precious human capital. So to answer your question, Ivor, I mean, I think Dawn alluded to it, that we've got as many as 1 in 4 children under 5 who are stunted in South Africa, and as many as 1 in 3 in the lower income quintiles. And this is far higher than one would expect for an upper middle income country such as ours, and far higher than many of our developing country counterparts. And it's of grave concern because stunting has long-term consequences for children's health, education, and economic prospects across the life course. Stunted children perform worse at school than their non-stunted counterparts. They're less likely to finish school. They're more likely to live in poverty and unemployment as adults. They are at increased risk of chronic diseases like diabetes and heart disease and hypertension in adulthood, and on average have lower life expectancies than non-stunted children. And bearing in mind that I think both Dawn and Francois have iterated that for the most part, stunting is preventable. So it's unjust that we've allowed it to persist and continue to allow it to persist at such high levels, because essentially stunting is shortchanging the next generation's chances, their capacity to learn, and it undermines their ability to obtain jobs and fully participate in the country's economy. It also leaves them in worse health, robbing them of a full and productive life and placing further burden on an already fragile health system and overstretched state services. And what's worse is that it's affecting our country's poorest communities most severely, threatening to widen the divides that have become characteristic of South African life, and trapping families in intergenerational cycles of poverty because stunted mothers are more likely to have stunted children. The good news, though, is that it can be beaten. And so what I look forward to today, Ivor and Dawn, is discussing with yourselves, as well as with Mark and Francois, how we together can get South Africa on the path to zero.
Dr. Wegerif, Mark, maybe we can engage you at this point. If stunting has become chronic in South Africa, and thus the norm, that makes it much more difficult to address, what's the first and most important step that we should be taking at this point in time?
Well, first, let's be clear, it is a chronic problem, and that's one of the reasons why it's hard to deal with. It's not a new thing. It's been with us for as long as we've ever been measuring such things. And in fact, we had in the country made progress in reducing the proportion of children who are stunted. But the real concern at the moment for me is that not only is the level very high, the latest credible figures we have say 27.4%, which I think was a 2018 figure. But worrying is that that was higher than the 2012 figure we had, which was 27.2%. Not much higher, but higher, which means we're going the wrong direction. And if we look also at the increasing levels of food insecurity, we can anticipate that in the coming years, the number and the proportion of children stunted is also going to be getting higher. Just to add one thing for me that was shocking on what Dr. Mabasa was saying in terms of the impacts, there is also an emotional and psychological development impact of stunting, and including reduction of impulse control of people who are stunted as children. So it's very credible to link also even high levels of violence and gender violence to stunting. It doesn't mean that every child that was stunted is going to be violent, but it does, just as stunting decreases other cognitive abilities, it also decreases things like impulse control and therefore can contribute to things like gender violence. So it's really serious, but it's hard to see it as serious. We get used to it. In poor neighborhoods, all the children are the same size. They're all a bit short. We only comment when there's the bigger, fatter baby and say, oh, that's a big baby. When in fact, we know medically and so on that larger baby is what all the babies should be if they were and their mothers were getting the right nutrition. So drawing attention to it, giving it the urgency is a great challenge. So we definitely have to increase awareness. We have to make people realize this is a problem and that it can be addressed. But also I think there are no easy solutions. There's no one easy solution. We should take whatever quick steps we can, but I would argue for a systemic approach that has to really transform the food system. And so we want to outline a little bit, this what we mean by food security and the dimensions of that, because for me that's important for us to understand in seeing why we need a food system kind of approach. And I want to also challenge this idea that goes around that Ivor mentioned, that we as a nation are food secure. I mean, the land, the geographic area of South Africa doesn't eat food. It's the people in South Africa that need to be food secure. And the only measure of whether we're food secure or not must be whether our people are food secure. And that means, according to all the widely agreed definitions, a situation that exists when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and a healthy lifestyle. And that involves four main dimensions. We need food availability, we need accessibility, we need utilization, and we need also stability of supply. So accessibility is the food is there on the shelves, and indeed food is there. The quality of it is an issue sometimes, but the food is there. The first big challenge we have is accessibility, that people go hungry in South Africa's system approach. Just delivering cheap food is not solving the problem if you're putting people out of work, etc., and therefore creating greater hunger. Utilization is very important, and Dr. Mabaso will probably know more about that, but the food being in the home doesn't mean everyone eats equally. There are gender discrimination and dynamics to that. And also a child who is sick is not biologically able to absorb all the nutrition from the food. So there are children who eat enough food but don't get the nutrition outcomes because of health. And that's where we have to combine it with healthcare interventions. And then stability is critical because we have to be able to survive shocks and we have to think of the future. We can't, for a sustainable food system, we can't have a food system that feeds us today but at the expense of the next generation because we degrade soils or we drive climate change, etc. So we need a systemic approach. And yes, we want the quickest fixes we can, but we also have to take a longer term view and we have to address a range of factors holistically if we're going to have a sustainable solution for this generation and for the coming generations.
That's actually a refrain we've been hearing throughout the COVID-19 lockdown in South Africa. I think the veil's been lifted. We can no longer just assume that we are a food secure nation because all the evidence, Francois, is pointing to the contrary. The food system is beyond broken. Just maybe a tiny step back for some of the people joining us on all the different platforms. What exactly do we mean when we talk about stunting? Stunting is when a child is simply too short for his or her age, and that represents much more than just growth failure. And I've been reading up on some of the research published in some medical journals, including the Lancet, and it says during the first 1,000 days of life, spanning the period from initial stage of pregnancy to a child's second birthday, nutritional deficits can irreversibly damage health, growth, and development. And Francois, at the FairPlay movement, you linking that directly, as you said in the beginning, to dumping.
Well, dumping is a form of predatory trade. And of course, particularly the importers who make fat profits off the predatory trade practices deny that it's happening. But many countries have already been found guilty of dumping in South Africa over the last 10 years. And I've no doubt that more will be if we have the means to bring all the legal actions that are necessary. But just as the food system is broken, the trade system is broken too, because if you look at the World Trade Organization, it's as fast as molasses. So the problem is not a lack of protein in the country, it's access to that protein, Mark. And Kupano, that's really an issue for fighting stunting, correct? Is access to protein, access to the right foods at the right age. And also for the parents of children to have the right foods. It's not only about feeding the children, it's about feeding the parents. And so if we want to take a systemic approach to solving the problem, we also have to fix the trade problem. We can't have small farmers going out of business so that they're unable to feed local children and local parents. We can't have those at the lower ends of the jobs ladder having no income, being unable to feed themselves and their children. So this is about jobs. It's about employment. These things are all linked. And that's the point we at FairPlay like to make is let's make the linkages. But more importantly, stunting has both an I and a U. We all have to work together to solve this problem. We can't stand aside. And even if you're an importer who's made millions, and good for you, you've now done your damage, but people should start putting money into helping children to get the right food and helping their parents to get the right food. But most importantly, we all have to make sure that we create employment and protect employment in South Africa.
It's an I and a...
I was just going to come in and respond as well, but is that Dawn?
No, you can go ahead, Dr. Wegerer.
Sure. No, I was just, I've sort of lost my train of thought now, but I was just going to say that, one of the things is that when we're talking about the parents being fed, I think we have to be clear that we need a particular focus on women being fed and women having adequate nutrition and healthy lifestyles. And what we see is a continuing discrimination against women. So one place to start would be, I don't want to say empowering women. It's more, how do we end the discrimination that women continue to face? And because it's the healthy and well-nourished mother that will give birth to the healthy and well-nourished child and avoid stunting. The stunting starts in the womb when the mother is not nourished enough to give adequate nutrition to the child even before the child is born. And what we've seen is that women are, it's been revealed very clearly by COVID. We knew it already, but there was the NIDS-CRAM report that showed that of 3 million jobs lost in the first months of the lockdown, 2 million of those were women. And that's because women are at the bottom of the rung. And even in agriculture, they're often the smallest farmers and the most vulnerable, or when they're employees, they're often the most underpaid and most vulnerable employees, earning too little to be able to feed their children adequately, even when they're working full-time, growing food in agriculture. So we have to focus on women will be one of my appeals. And certainly we have to protect the South African agricultural sector and its job creation potential from just unequal world trade, the dumping, and so on. We can't be expecting farmers to compete with subsidized agriculture in other countries or other countries that simply benefit from low exchange rates, something as arbitrary as that. Because China's exchange rate is low, it doesn't mean our farmers are not working efficiently, so they shouldn't have to compete with that. And the problem when we try and compete with that is that the farmer themselves is also forced to push down on workers and pay them wages, which even at the minimum wage don't buy adequate nutrition, as we've seen. And often that is also women at that end. So we need a viable, vibrant agricultural sector that can maximize jobs. And instead of losing jobs, we've lost hundreds of thousands of jobs, not only in the chicken industry, but hundreds of thousands of jobs across the agricultural sector in the last 20 years. That's hundreds of thousands more people going hungry, their children being stunted.
You make it.
I find it absolutely.
I'm picking up on a point there. Mark, you make a very good point, which is the whole value chain of food. Because, I realized early on that Brazilian chickens don't eat South African maize. And so even like the poultry industry is one of the most competitive in the world. So they can compete. It's not about being competitive. It's subsidies and other forms of pernicious trade that becomes predatory. And you look at Ghana, for instance, and in Ghana, a chicken is now as expensive almost as steak is in South Africa. And it's because the local industry has been wiped out. And I just think if we get back to what are the things we need to do, both short-term and long-term. So yes, we have to change the system, but Kupani, you made a very good point that it's preventative. How do you actually as a family prevent malnutrition in a child? That's bothering me since yesterday.
Yeah. Look, the burden of preventing it really would be unfair to place that on a poor household. And so it does require a whole of society response. And if you look at countries that have, and they are, Senegal has done really well, Ghana, Chile, Peru, Brazil. So we're not talking about your high income countries. We're talking about countries that are battling with HIV, battling with unemployment, battling with similar challenges to us, but have managed to get on top of this. And what they have in common is they have this focus on women of reproductive age. Yeah. So as well as children, in the early years. So what you call your first 1,000 days from conception to age 2. There's also high political prioritization and leadership around this issue, which we don't see sufficient of that in South Africa. And then there's this cross-sectional response, because, as we've said, we're talking about food here. We're talking about healthy environments, because it's one thing for children to be eating good food, but if they don't have water and sanitation, they're having repeated bouts of diarrhea, they are unwell, they cannot retain those nutrients. And then you need care. You need immunizations to protect you from illnesses. You need deworming to protect you from parasitic infestations that make it difficult for your body to retain. So all of these domains need to work together, but they sit in different departments. And so countries who've effectively reduced stunting have had this sitting at the highest level of office and coordinated, so targeted, focused, and coordinated, looking at the same operational metrics and reporting on them. So when we say preventable, we mean that, we think of just the child support grant, right? We're doing really well. It's well targeted and it makes a difference, but we're missing pregnancy, which is really where, women need it the most. We've got about a 19 stats, about 15% of children who were born with a low birth weight, meaning that they were born under 2.5 kgs. And that's a major risk factor for stunting. Food insecurity in pregnancy also puts women at risk of poor mental health. And that becomes a vicious cycle, because if you're depressed and anxious, you can't work, you can't find work, you yourself don't respond to cues from the baby. And so you've got this vicious cycle of food insecurity also fueling other chronic conditions. And so, if we were just to extend, for example, an existing policy, add a 9 months earlier to an 18-year program, it's a little bit of money, but it's a huge investment. And we know the Heckman curve, that if you invest in the first couple of years of life, your returns on investment are huge. So as a country, we need to have a long-term view, but also act on things that start to pull the levers that are easy to pull in the short term. Because take the lockdown, they estimate about 300,000 babies born during that time into an environment of high unemployment, unemployed mothers, food insecurity. And so we need to both be identifying what are the downstream things we can do quite quickly, and what are the more upstream, longer term system changes that we need to be working on in parallel. And it shouldn't be either or, because we won't shift the needle on stunting if we don't start working on both.
It was quite interesting or fascinating to hear Dr. Wegerif talk about, or sort of speak about, the links between dumping and stunting from an agrarian academic perspective. But Dr. Mabaso, if we can stay with you for a moment, maybe we can just pinpoint some of the causes of stunting before we go further, and then also why we haven't found affordable permanent solutions for this. What you just alluded to that a moment ago, that it should actually start way before, and it would have a much longer term impact. So maybe you could just touch on that.
So some evidence or data from countries where they've looked at kind of what are the combination of factors that make children really vulnerable. And so there's this sort of dyad of food, healthy environments, and care. So food, both quantity, so you need to have enough food, but also diversity. And according to the 2016 South African Demographic Health Survey, only 23% of children between 6 and 23 months are eating a minimally acceptable diet. So that's already telling you, what Mark was alluding to earlier, that we have food, but children who are transitioning from breast milk to the family meal, which is a very vulnerable period for children, so that's 6 to 23 months, only 23% of them are having a minimally acceptable diet. And if you look at the score for that diet, it's not salmon and sushi. It's your very basic foods that should be available to a normal family in a normal society that protects its vulnerable. So there's the food diversity and quantity. Then, as I mentioned, there's the healthy environment. So you need water. And we saw that with COVID. Many communities don't have access to water. In fact, you need sanitation, right? So you need to be able to relieve yourself in a clean and safe way. And about a fifth of children live in households that don't even have a ventilated pit latrine. So, the bar for adequate sanitation is quite low. So already mom can be doing her absolute best with a grant, But if she's not able to wash her hands, if she's not able to keep the environment safe, that baby's going to have multiple bouts of diarrhea. And then you need care. So you need a baby to get the very basic package of primary health care that around the world is standard. So your immunizations, your deworming, in pregnancy, your iron and folate supplementation, and breastfeeding support. So although we offer it in the health system, there's lots of barriers to access. So there's the opportunity cost to go to the clinic. Women need to pay for a taxi fare. If you're a farm worker, that's not a really easy thing to negotiate, right? And then there's those first 1,000 days when children are not in institutions, they're not in the ECD center, and they're not at school. So all our programs start at that point. They start feeding children in ECD centers. They start feeding children in grade R. But in the first 1,000 days, you've got mom and baby, sometimes teenage mom, unemployed, poor, depressed, anxious mom, alone with baby in the home. And so we have this workforce that we're really not leveraging, the community healthcare workers who are in communities going into homes, but are still doing your sort of old HIV, TB, things that were necessary at a time, but actually we've got this workforce that should be pivoted to be, if they encounter a child in the home, should be opening the clinic card and saying, hey, this baby's not growing well, mommy. Oh, you missed this appointment, mom. So there's some really basic things in the health system as South African we can do better. And when you look at other countries, we do offer free primary health care. We've endorsed all the possible WHO, everything. We've signed it. We've agreed to it. But it's in the implementation. I think South Africa, we know that. We've got policies that give you goosebumps. They are so well written. But actually, what does that policy translate to for a family in Nkomazi, in Mpumalanga? That's a different story. So I think we really need to start focusing on not just funding lots of consultants to write great policies, but actually tracking what happens in communities and measuring it over time.
So if you've just joined us, good afternoon. Welcome to the FairPlay and Food For Mzansi webinar on the eve of National Children's Day. We're talking about child stunting in South Africa. It's an issue so often swept under the map. We've got people joining us on Zoom right now, but also on YouTube, on the FairPlay social media channels, Food For Mzansi's website, as well as the Food For Mzansi social platforms. Our panelists this afternoon are Dr. Kupana Mabaso, Dr. Mark Wegerif, and Francois Bird from the FairPlay movement. And I'm burning to ask Francois another question, but if you'll indulge me for a moment, Mark. I'm seeing some of the tweets coming in. The big issue, possibly one of the biggest 2020 issues besides COVID-19, has been land reform, land redistribution in South Africa. Do you see this program aiding or hindering food security in South Africa? And what role, if any, will land redistribution play in addressing stunting and malnutrition?
Well, certainly the current program we have is not very effective, so it's not going to play a big role. But the potential for far-reaching land and agrarian reform to play a role is there if we can get it right. And I think we do have to get it right. We have to get it right from a justice point of view, but also because restructured land relations can be the basis, and they will be an essential part of a much more equitable food system and more equitable economy. So we do need to try and get it right, and we can get it right. The way that it will impact positively on agriculture, on food production, and then through that on child stunting will be if we can integrate land reform with wider food system transformation. One of the weaknesses, I think, of our land reform program in South Africa is that we think we can distribute land without changing the nature of power relations in the markets, in who controls the processing and the distribution and so on. And I must say, that is partly about how we manage our place in the global economy, the concerns that Francois and FairPlay have with dumping and so on. But we also have to look within South Africa, and we have a highly unequal system where a smaller and smaller number of large producers are capturing most of the value of production and most of the market space. So there's, even aside from the dumping question, we have small farmers being pushed out of business and very little opportunity for new black farmers coming in to succeed because of the high level of inequality and concentration, not only in land ownership, but also keep this division of commercial farmers this side, were basically white farmers, and then black farmers in the homelands of some other group. Let's look at all our farmers. There's more than 2.5 million people who farm, but only about 7,000 of those farms produce over 80% of the agricultural value. And this is now increasingly, these are companies, not even what we would call a farmer. We can see something like a company like Future Growth. It's an investment firm. It's invested over 400 million rand in 8 farms spread across the country to diversify risk. They outsource production to production operation companies. They have over 4,000 workers, but 85% of them are seasonal workers. So most of the year they have no income, and that's when their children are going hungry. So they are getting economies of scale, which maybe enable them to compete in the global economy. But they're not creating secure jobs. They're not creating the knock-on effects of more multipliers through processing and local markets in the local economy. So we need land reform, we need agrarian reform, but we need to integrate that with a wider food system transformation. Maybe the last point I'll say on that is just, we can't succeed in this by just trying to reduce the price of food. Farmers need to also get fair prices for their food. But what we have to look at is, where does the money we pay for the food go? And it's very clear that at the moment, some big processing companies and the big supermarket groups are capturing an unreasonable proportion of the value. It's not value that's going to the farmer. It's value that's being captured often by foreign-owned or large corporate-owned companies and supermarket groups. I think that's something we have to address, so that more value can go to the farmer and the buyer can get gets a reasonable price as well.
Iva, if I may, Dawn, if I may just ask something, because it really, every time I listen to Dr. Wegerif and Dr. Mabaso, I learn something new. And the thing I've just learned is how much policy is in place and how little execution is taking place. And my question is, how do we get that trigger pulled? Iva, do you have any ideas on how we can work together to get that trigger pulled on action?
That's a very good question, and links with one of the questions, Dawn, that I saw coming in on the Facebook page of Food For Mzansi. Simone saying, who's responsible for nutrition education to the society? We've got the policies in place, but where does the buck stop? Why is this happening? Why are 27% of kids then stunted? Let's see what the experts say. Dr. Kupana?
Yeah, look, I think we often look to government as sort of the sole and only responsible one. And I think government can do better in many areas. But I think there's also a lot we can do in communities as well. I take, for example, our labor law makes provision for women to take 2 30-minute breastfeeding breaks in the workplace. Few employers, there was a survey done, even some of the sort of rights-based organizations, few employers are even aware, right? And so this is not part of even HR policies. And, it's often said that if breastfeeding was a product discovered today, it would win both the Nobel Prize for medicine or science and for economics. It's both an economic intervention and a health intervention. There's a Lancet paper that suggests that babies who are exclusively breastfed have higher IQs because breastfeeding is so protective, both against the gut in terms of gut health, but also in terms of brain development. Now, we often are unfair to moms. 32% of women in South Africa breastfeed exclusively to 6 months. But do we create enabling systems? We talk about women's rights. Do we as employers ensure that women can breastfeed, that they support it, that they can take paid maternity leave? So there's a lot that civil society and private sector can do. But in terms of government, absolutely. We need, as I said, we've got lots of fancy policies. And I think this is not just to do with health, it's across South Africa. But we struggle with implementation. And I think holding our leadership accountable. And we've done this before, right? The sort of pre-ARV fights, in South Africa are an example of how us as South Africans can come behind something that we know needs to be done and can keep our foot and pressure on that so that it does happen. And I think stunting is calling for us to do something similar.
Yeah, I think Dr. Mabaso, as a new mum and someone that also came through the system, I'm with you on that point. The support and the engagement, there's not enough. So I'd like to go to Dr. Becher if we are engaging on Zoom as well. So this question came from Michael. Michael is asking you, Dr. Becher, do we have policies on food fortification? And again, would you say that the school feeding schemes or programs comes too late in the day?
Okay, thanks. Yeah, I think I just answered him on the chat line as well, but I'll answer for everyone who might not be following that. That yes, there are policies on fortification. So we do see vitamin fortification of most of our maize, etc., which is positive and it's worth doing. And we should continue that and broaden that. But I don't think fortification can ever replace the balanced diet that Kopano was talking about, because a diet is a very complex thing. You know, we need the fibers and so on in our diet to help our digestion, to get, you know, all the nutrients out of the food, etc. So fortification, yes, great, and it's being done to some extent, but it doesn't replace the need for a balanced diet, which must include fresh fruit, fresh vegetables, and so on. And yes, the NSNP does come too late for stunting. We measure stunting for 5-year-olds. So the 27.4% figure is 27.4%. More than 1 in 4 of our 5-year-olds are stunted. Of course, those 5-year-olds haven't started school yet. But I do want to say, and you know, I've been hearing the talk about the implementation challenges. I do think the NSNP, the National School Nutrition Program, is a fantastic program. You know, the government feeds 9 million children every day. And just last week, I went to some schools in Mabopane and Shoshenguve, and I saw children eating. And I was also struck that we had the COVID brigades were there, and they were helping to maintain social distancing and have these small children, including the grade R's and so on, line up with social distancing, get their food and so on. You know, it's quite impressive, you know, and I think we should kind of embrace where some things do work, you know, and we should absolutely carry on with that. We can do more with it to help support black farmers and use that purchasing power to help transform the food system. That's like another debate. But yes, it's too late for stunting. So we need interventions that start from when the woman is pregnant. And this is where I like Kopano's suggestions, which I mean, extend the child grant to the pregnant mother. And we need that gap right from conception and in fact pre-conception, because, and this is where I said earlier, I want to repeat it again, we need women in society to be healthy and well nourished. And, you know, and that will be a big contribution to reducing stunting. So we need those interventions. I think Kopano mentioned good ideas of extending the grant, making sure, you know, feeding and so on goes also into early childhood centers and beyond those. And we need a more coordinated approach to that. You know, and one of the problems we have in South Africa, there are good bits happening. The grants have made a big difference. The NSNP is a good program, but it's bits and there are gaps in it. And what we don't have is that coordinated view. We had this food and nutrition security policy passed in 2013, but there's very little implementation of that. That talked about things like, I think they called it a council, a food security council or something, which hasn't been established. It talked about the need for new legislation, which would give effect to the right to food in our constitution. That hasn't been passed. So there are clear gaps at that level. But there are things we can do. But I think there was a question earlier around sort of the change and resistance to change. The challenges and where we get resistance is when we talk about, you know, challenging vested economic interests and where we want a greater transformation that would change where value in the food system goes and where we need more democratization of the food system that is currently far too much controlled by a few vested interests. That's where the change is difficult, but we need that change as well alongside these other government interventions.
I think the issue is really that it seems to me, we need a sort of a national emergency task force to really get things going, because unless sort of a national task force to end child stunting, and they must do what must be done. And if I understand it correctly, if we don't do it, it's unconstitutional.
So if we're saying, Dawn, that child stunting is a national emergency, and many of our consumers people participating in this webinar are saying the prices of food as well is a national emergency. Dawn, I see a question came in from Sandile Dlamini.
Yeah, Sandile Dlamini is saying, I've noticed the price of food has increased exponentially over the past year. Nutritious choices are really expensive. Vegetable prices have gone up. Chicken prices have gone up dramatically. And he's asking, is there a intervention that can be made to keep prices level for access? Franco, maybe you'd like to come in here.
Well, I think the issue is that we should do everything possible to support small-scale farmers. The farming industries as well should coordinate, because, as I said, South African chickens eat South African maize. So if the maize price goes up, everything else goes up with it. Now, we're not saying at FairPlay that we must stop the market because we want to get off. We believe market forces should play a role. But that's why I believe a national task force must be started to make sure that vulnerable people, or potentially vulnerable people, like expectant mothers and small children, are taken care of in time through everything that's available to us, every lever that's available to us. If our country could step up to the plate and deliver a soccer World Cup or a rugby World Cup or a cricket World Cup that's of international standard, why can't we rather step up to the plate and end child stunting? And for me, that would be a thing that will get me far more enthusiastic because those children might one day become sports stars, but it's going to be important for us to do short and long term everything from food gardens. I've seen such wonderful stories about people making food gardens on their pavements so that anyone could have access to it. Now, this is not something we need to wait for the government to happen. Everyone can do that. There's nothing stopping anyone from doing it. But we really need to do the big, important things that must be done today for children to have it tomorrow. And so I think we need that national task force to end this problem.
Absolutely. Alvo, if I may.
Yes, I was just going to say, I'm sorry, Dr. Kopana, I was just going to say, we've been asking about what should be done, and the national task force perhaps is one of the answers. But a lot has been done, and I know Grow Great has been highly active in this field, Dr. Kopana. Tell us about some of your achievements, because you've been doing quite a bit. And how do you feel about a national task force?
Yeah, look, I agree. And I was going to say that even if the moral sort of, pull at your conscious argument doesn't work for some, the economic argument itself is very compelling. I think there's a lot that has been done both globally, but even locally around just the cost of having such a high burden of stunting to a country. I think the World Bank estimates that countries in Africa and Asia with high levels of stunting similar to ours are losing 8 to 11% of GDP. And we know we can't afford that, right? And just even from a human capital point of view, we talk about being a fourth industrial revolution nation, smart cities, and none of that, we can't realize that if we have a quarter of our children whose capacity to learn is undermined even before they get to school. There's some interesting local studies that look at reading speed and compare the speed of a child who's stunted to a child who's not. This is recent studies, and it's heartbreaking to watch just how these children struggle. So all the interventions we layer on from ECD centers onwards, we're almost throwing money into a sieve, because we really need to get the foundation right. So, to speak about our own work, really primarily we're a campaign to, create awareness and to galvanize a national commitment. So stunting certainly is not going to be resolved by Grow Great alone, but we are putting our sort of money where our mouths are and trying to demonstrate what you can do if you actually implement some of these really good policies. So in certain provinces, we partner with provincial governments to support community healthcare workers, to train them, to support them, to equip them, to skill them, and to give them feedback. Because I think community healthcare workers have we use them. I mean, you look at COVID, suddenly they all sort of, contracts are being renewed quickly and they're screening, and then they sort of sent back to kind of this job insecurity that they were in before, when actually this is a workforce that is trusted by the communities, that is entering homes, that can play a huge difference. So in Mpumalanga and Limpopo, we've got good relationships with those provincial departments of health, and are working with a significant number of their community health workforce to demonstrate what you can achieve. We also know that our health system is strained, right? And we can't pretend about that. I mean, we saw that in COVID. We know that the tension between private health sector and public, and how many of our health workforce are sitting in private health sector. And so the public system is strained. And so we can complain about that nurses and doctors are not doing enough, or we can try and introduce community-based interventions that augment that. And so we run a social franchise. So it's a micro enterprise for women who themselves live in communities, who understand the challenges. So these are mothers, what you call your positive deviants, women who are sitting with the same set of conditions, but have managed to raise healthy children, have managed to overcome. So they really understand how to hustle and work their system. And we train those women to run mom and baby groups. And it's a social enterprise. So they charge fees for this. It's run in communities. We're in 4 provinces. We've got about 150 of them. So again, trying to demonstrate what can be done with committed people. And then we do research, because we actually can't track whether we're making progress if we're not measuring it. So the South African Demographic Health Survey is fantastic because it gives us a national sense. But if you look at the sample sizes at provincial level, they're tiny. So what's driving stunting in the winelands could potentially be very different, where you've got high burdens of fetal alcohol syndrome, to what's driving stunting in Limpopo, where people don't have good water and sanitation. And so if we're going to use our limited resources, we need to know exactly what we're trying to fix in this community, which might be quite different to a community that's got avocados and mopani worms, which are amazing in terms of a protein-rich food and can be added to porridge and are fantastic for babies, to an urban informal setting where people can't grow anything, where my parents are working the whole day. We're drawn on ECD centers that only feed up from breakfast to dinner time. So that's another thing we do, is doing surveys and studies door to door, household to household, trying to map what is driving stunting in particular communities. And then just, creating awareness, because I think, once us as South Africans start to demand this as something that we want our political leaders to change, then it strengthens all of this and we'll start to see things moving very quickly. But unfortunately, this is not, even for myself, before I was in this role, I knew about stunting, as a medic really, but I didn't realize the sort of public health and economic impact of it. So really sensitizing South Africans that this is a justice issue. This is not a health condition. This is fueling inequality. And I think as middle class South Africans often kind of see these as poverty related issues that don't affect them. But in fact, us as a country, our sort of prosperity, the stability of our country, everybody in South Africa worries about crime. Well, I can tell you, when you're shedding thousands of jobs, when you've got lots of angry, unemployed dropouts, young people who can't get a chance in the society, we're going to live in a very unstable South Africa. And then in terms of our own investment of the future of the country, if we really want to be the South Africa that we know we can be, and we need to invest in the foundations for success. And stunting is one of those. Well, reducing stunting is one of those foundations for success.
I think Dr. Mabasa should head up this task force. This national. You're the person to lead it, clearly.
I think the engagement on our various platforms we are quite active there as well. We have a few questions that came through, and perhaps I can pose to Dr. Vegere or Dr. Mabaso. You can also join the discussion. There's a question here from Guguletu Matlango. Guguletu Matlango is asking, how can farmers contribute to ending child stunting? It's quite clear that farmers are even struggling with securing market value. And how can we change this? And then she's also asking around food waste. As farmers supply markets food that's not appealing or the right size, and look for supermarkets gets thrown out and rejected. Why can't this food get to the people who need it and the nutritional value, vegetables and fruits? Dr. Mabaso or Dr. Vegere, maybe you can also join here.
Let me make a few responses and maybe touch on some of the other things that have been discussed. certainly I think a national task force would be great to have, and bring together people focused just on how do we achieve food security, how do we end stunting, and looking at the food system from that perspective, not looking at how we maximize profits or GDP, which can be nice for some, but looking at the end result we want, which is how do we have a healthy, well-fed nation. And so I think we can do that. In terms of farmers playing a role, I think farmers have many roles to play. Of course, producing good quality food. And personally, I'm a proponent of agroecological approaches where they work. I know they're not always easy, but whether we take those approaches or not, we need to ensure good quality food is there and at reasonable prices at least. But as I said, farmers need to get a reasonable return, because the other big contribution farmers make is through employment. And the more people we can have employed, but also, for me, I would prefer to see more people with their own farms, with their own businesses. What we need in South Africa is not just employment. We need ownership opportunities. We need more people having a greater stake in this economy. And I think, many more small farmers, and the small farmers we already have, as I said, there are actually millions of them. They do, and they can make a contribution. They can make a much greater contribution, especially in that employment and income earning. And I think related to another point I saw in the chat line, and this relates also to the waste point that Guguletu was raising, I think when you have local markets and selling, you can reduce quite a bit of that waste. And certainly when you have local street traders, there's less sensitivity to whether the banana is exactly the right shape or color, etc. And which is a big issue in the supermarkets. And so they're more selling affordable food to people. And I'm not saying the quality is worse. And often the quality is actually even better in the street. But I'm saying they're also not applying some of those kind of more visual marketing related kind of dynamics. And the other thing that happens is that when the street trader's food, he knows it's now getting older, he or she reduces the price to move it quickly. Already, where the supermarkets are less nimble in doing that, and that can, so what I'm saying is that farmers linked to local food systems and street traders, I think, is one option. And one of the things which relates to the point someone raised on pricing going up, I've just been amazed in some of the research we're doing at the price difference between what is sold by street traders in places like Johannesburg and so on, and what you get in the supermarket. Just for an example, this is figures from last month. When we go to a street trader and they're selling cabbage and, at just under 5 Rand a kilo, they were selling the cabbage, and the supermarket's more than 10 Rand a kilo. That's twice the price on cabbage, which we know is affordable food for many people. Onions, which are used all the time, we got street traders selling onions at 9 Rand 20 a kilo, and in the supermarket it was 15 Rand, 162% more expensive. When you go to something like the robot, the nice, which is nice and healthy food, and it's affordable in the street. When you can buy for 5 Rand, 8 Rand, you can buy your robot, and you're paying 12 Rand, in this case 12 Rand 60 per kilo, and the supermarket 63 Rand 30 a kilo on the same day. That's 5 times the price in the supermarket. So, I know where the increased prices in the supermarket value is going, because often those things are coming from the same Johannesburg fresh produce market. And, I'm paying 5 times the price literally in the supermarket. So that's going in profits. It's going, but it's not helping farmers and it's not helping the consumer. So I do think there's a lot of value we can get with smaller farmers who create much more employment linked to smaller traders and so on. Did I answer all the questions?
Yes, you did. Beautifully.
But the other thing with small farms and waste is when you have a link and you have circular economy, and the local trader, has their waste going back into compost for local agriculture as well. So those links are very important to look for. Then it's not waste anymore. It's going back into the soil at the end of the day, and that's important.
Mark, I was just going to bring up the importance of regenerative agriculture and the local economies, but that's a separate discussion all on its own. Francois, you look like you want to add to what Mark was saying.
No, I just wanted to say, I think what we shouldn't do is to sort of say, well, what we don't need is the large retailers and sophisticated systems. We need all of the above. But what we need to really take into account is that right now we're neglecting the small traders, we're neglecting the small farmers, we're neglecting the whole issue of child stunting as a national priority. It should be, for me, I feel ashamed that it's not, and I feel ashamed for myself that I've only recently come to this realization that this is such a massive problem. And, how did I miss this? It's not right that we miss these things.
Yeah. So, certainly, I'm not saying get rid of them. Certainly not overnight, But maybe in the longer term. But it's also the regulation, because why do they have a dominant position? And the Competition Commission did a very thorough investigation of the grocery sector, and they found extremely anti-competitive practices, and where the supermarkets, because the mall developers need an anchor supermarket, the supermarkets use that to negotiate exclusive agreements that, first of all, give them lower per meter floor space. That means they're paying less per meter for the floor space, but it also means that the supermarket developer has to pass on that reduction in income to other shops. So they actually start charging more to the other shops. But many of the supermarkets also insist on an exclusivity agreement, where they do not allow another grocery store to operate in the same mall. So we're all fed into the mall with transports and so on, and the advertising says this is where we've got to go. And the supermarkets are locking out other competition, so that sort of practice surely has to end. And one of my suggestions, also a simple thing we could be doing for the food system, would be that we have to make available much more public market space in all of our areas. That creates income earning opportunities for people, and it also makes food more locally accessible, because the mall is also not an accessible option for many people because of transport costs, etc. So many countries have these kind of regulations. China has a very good crawling peg policy they implement in many cities, where per 1,000 or so of the population, I can't remember the exact number, there must be a certain amount of square meters of public market space. And 90% of that public market space must be reserved for small scale food sellers. So it can't also just become imported Chinese toys and stuff. So what that's doing is putting fresh produce in walking distance of everyone, even in big cities. And that's income and business opportunities for local entrepreneurs. And they link more effectively with local small farmers because of their scale is a similar scale of operation. So there's a lot we can do in our urban and town planning to create space for food businesses that make food more accessible. And that's making the food more accessible for the eater of the food, and it's making the market more accessible for smaller scale farmers who can link to those markets.
Yeah. Every time I listen to you, it seems to me there's a lot that can be done. And increasingly my worry in this conversation has been how little is being done. And Iva, how do we galvanize the nation?
That's a very good question. And if we're looking at what's happening in terms of our economy, where are we going to find the money to create this national task force to curb child stunting, Dawn?
Yeah, no, definitely. I think Dr. Wegerhoff mentioned some of the solutions, but if we can maybe steer the conversation towards that as we sort of wrap up today's session. Dr. Mabaso, how do we eradicate child stunting? And Grow Great has basically a lot of great initiatives and plans around it, but what are some of the practical and cost-effective steps to do this? Maybe you can share some of that.
Sure. So, I think Mark said at the beginning, and I might have said it as well, that there isn't a silver bullet, but there certainly are examples. And I think we often have a South African exceptionalism where we sort of, there's lots of our neighboring countries who have done this brilliantly without massive budgets, right? Because they didn't have massive budgets to do this, but they decided that this was an important enough issue. And I think we're often just, we need to put our heads down and actually focus on this, because it is the foundation for a lot of all the other things we want to achieve as a country. So there aren't silver bullets, but there are things that have worked. And as I said, we have a workforce of 70,000 community healthcare workers who could be better supported. That's an existing workforce. Those are people already in communities. We have a wonderful social security basket that protects poor and vulnerable people, but we've missed a trick. We've left out 9 months, and I would argue one of the most critical 9 months. And I think that needs to be relooked at. There's also just great innovations that have come from other countries. So I was thinking with the earlier question, I think it was Guguletu's question around, what can I do, right? And I think sometimes these problems, people check out because we're sort of numb. I mean, there's so many crises in South Africa. It's another crisis and it's quite overwhelming. But there's a lot that we could do at individual level. So Ecuador gave children 6 to 12 months an egg a day. Now, eggs are like almost a perfect protein. They're full of choline, which is amazing for brain development. They ran this in a study. They're affordable. They can be mixed with porridge. So a lot of our babies are transitioned onto porridges all day, every day, which is macronutrient rich, keeps them full, and actually they sleep pretty well, but micronutrient poor. So there's a hidden hunger, that's happening here. So they added eggs. Who would have thought? And they reduced stunting in this group of children that they followed by 42%, right? So we're repeating this. I mean, it's unbelievable. So Gates Foundation, everybody's like, what? So studies have been run around in different parts of the country. We're doing one at the Northwest. But those are some simple things. And we've actually seen some farmers, come alongside us and donate eggs to activations. And it's been incredible because eggs are considered seshebo. Seshebo is meat in families. So when a family is poor, you eat pap and eggs. Dad eats pap and eggs. You're not going to waste eggs on babies. But if it was understood that this is a gift you're giving to your pregnant woman. So likewise, India's done a study where they were giving eggs to pregnant women. Likewise, that's an incredible simple thing that you can do if you're a poultry farmer and donate to your local ECD center. Because I can guarantee you those babies are eating eggs for breakfast and lunch at least. And just adding an egg to porridge makes a huge difference. So there's really practical things we can do. We can also push in a health system just to measure it. So in health facilities, we weigh babies, but we don't routinely measure their height because we want the chubby baby, the shiny, puffy, round baby. But in fact, that baby is also malnourished because obesity is a form of malnutrition. And in fact, we're seeing in South Africa a double burden of malnutrition where you have a short, stunted and round baby. And that might look really cute, but that baby is not a healthy baby. So, because food that is nutritious, that's micronutrient dense, is expensive, these babies are fed porridge early, are big, but are not healthy. So if we were measuring, if we were tracking at facility level, and if you open those clinic cards, you often find that page empty. So it's in there, but healthcare workers are not measuring these babies, not measuring their height because it's not tracked at national level. So they'll only measure what gets aggregated into what we call the district health information system, which is what we use to track progress. So there's simple things that we can start to do because then we can pick up hotspots like the Northern Cape, like Gauteng, which comes up in the demographic health survey as having the highest level of stunting in South Africa. But because the sample size is so small, nobody's convinced. But if we're routinely tracking data, we then know where we're making progress and where we need to quickly direct resources because that's where the big gaps lie. So I think there's a whole bunch of stuff that we can do already. And then there's the structural issues, right? So, I mean, we have one in 3 women in South Africa suffer from perinatal depression. And there's a huge body of evidence showing the connection between antenatal or postnatal depression and poor birth outcomes, both in terms of the baby's birth weight, in terms of their head circumference, but also even cognitive development. And this is something that can be easily screened at health facilities, but also something we as society need to be supporting our sisters, our aunts, our neighbors with, right? So there's a piece of this project for everyone. And you can pick your piece. It can be the food system. It can be the health workforce. It can be the data. It can be me as a farmer deciding that I'm going to donate a tray of eggs to this this creche down the road, once a month. And that will literally make a huge difference to those kids. So I think, Dawn, it's a big project, but I think it's certainly one that's not insurmountable. And I think it's an exciting project because, the prospect of zero stunting is a huge unlocking of potential in South Africa that we're just missing currently.
And many of the people participating in this webinar coming forward with great solutions. I see many tweets also from outside South Africa coming in. There's a message here on Zoom from Zola saying, perhaps we're missing another opportunity. She says, governments can use trade in diverse ways to influence the food system, to balance supply and demand for food while avoiding exploitation of farmers. And she's saying small farmers that would make food affordable, available to lower LSM groups. Dr. Wegerer, before we start moving the conversation to creating a national recognition for child stunting, Dr. Kupano was referencing the last 9 months. I loved that description during the pandemic. And we know that COVID-19 was devastating on the poor, particularly in South Africa, most parts of the world. How do we recover lost ground from there? And then maybe Dawn, we head afterwards to Francois with some of the national issues there. Dr. Mark?
Yeah, well, thank you. And maybe before we get into solutions, maybe to hammer a few of the problems we have and the challenges still and causes. And I think one thing that to be very clear about is that we were in a crisis before COVID. We were in an economic crisis of recession, and not just the recession of the last months. Basically, for the last 10 years, our economy in South Africa per person hasn't been growing, but inequality has been growing. Even when our economy was growing before, with inequality growing, it meant the poorest 50% of the population were staying in poverty, some getting even poorer. And that, of course, also meant increasing hunger. So we've seen hunger levels, in the last State of Food Nutrition Security report globally said that more than 51% of South Africans are experiencing at least severe or moderate food insecurity. More than half of our population is food insecure. And again, the really worrying thing about that is that that had gone up from 45% in the previous period. So we're going the wrong direction. I said, and food insecure people today means stunted children tomorrow and in the coming years. And so when we're seeing that level increasing, and sadly, the prediction would be we're going to see more stunting, higher stunting levels over the coming years. This is before COVID, and partly addressing Zola Brunner's points that she's been raising as well. What's been going wrong in that, and part of it in South Africa is inequality. And yes, I don't think anyone in this panel said there shouldn't be trade, including international trade. It is the nature of the trade and how it's regulated and who benefits from that. So. And unfortunately, the kind of economic growth, limited as it's been in South Africa, has not been creating jobs, has not been addressing bringing people out of poverty, has not been creating greater food security. So I was very concerned. I listened to, the last days, our president has been giving a lot of attention to this investment summit. And I happened to listen to the radio this morning, and an economic advisor to the president was being interviewed. The whole discussion talked about the amounts of investment, some mention of GDP. There was not a single mention of jobs, of equality or inequality, and of course no mention of hunger. So even some of the investment, and there was a lot of attention to what are we going to see, a building, a structure there. And no one says jobs. I see the buildings in Sandton. I cry when I see where my health insurance money has gone, into some shiny office block in Sandton. That to me is not progress if there's less jobs with that. So it's just frightening that kind of discussion happens. Yes, I'm not against the investment, but I'm saying we need an investment that creates jobs, creates more economic opportunities, creates more ownership opportunities. And in fact, half the investments go into technology that can even be shedding jobs. That doesn't help us. So that can grow your GDP. It doesn't help most South Africans. So that's where we need a different kind of priority. Now COVID comes along, slows the economy, increases inequality. And if you look closely at Tito Mbowene's medium-term expenditure framework, his best-case scenario sees our economy smaller in 2023 than it was in 2019, in real terms. That's his best-case scenario. We are in a crisis. It's definitely a time when more radical solutions are needed and justified, and that could include certain kinds of trade regulation. Again, Zola, I'm not saying no trade. I'm saying how do we regulate it to benefit the South African economy and South African people? And that's important. How do we regulate the sector so the value capture is not just in some large, mostly foreign-owned supermarket groups, but more of it goes to farmers, especially farmers who create jobs and who pass that on in better salaries to workers? And how can that go to new farmers, giving them more opportunity? So that's the sort of thing we need. And yes, and well, I do want to touch on Kopano's point, because part of what we are sold by some of companies and fast food chains is very unhealthy food. The obesity problem, which is, as Kopano said, a form of malnutrition, is also driven by what's marketed and the high salt, high fat content foods that are being sold to people. That is extremely damaging, and people who are spending that money on those foods instead of on fresh vegetables and so on. So that needs education interventions, and it also needs regulatory interventions where we say certain foods that are just really damaging to our health and the health of our children, there should be regulation around it. So the state, and with COVID, we have every reason, excuse, and need to intervene on some of these things and say, how do we build back a healthier economy and a healthier society?
I just want to shout amen, Dawn.
No, definitely.
Preaching for too long. Sorry.
So maybe we can now start talking about how do we bring stunting into the spotlight? How do we bring it to the fore and achieve national recognition? Fransha, you spoke about it when we started the discussion. Maybe you can touch on that again.
Thank you. I must say, as Dr. Mabaso and Dr. Weger have talked, I felt more and more like that shiny, chubby baby, at my age. I'm becoming more shiny and more chubby by the day.
I wasn't the shiny, chubby baby, but I am now.
Yeah. So a little levity is not at the expense of the importance and the gravity of this problem. And perhaps the issue is that, people like me at my age, I discover this problem for the first time now, and I feel terrible about it. And I think the start is to help more people discover this problem. We have access to any form of communication, and we should do more of that, all of us. The second thing is what I heard, that we already have many plans, but what we don't have is execution. And we need to find a way of forcing execution. And if those who are responsible for the execution doesn't do it, well, they need to be replaced. And by which I don't mean a political statement, by which I mean, if necessary, maybe we could get some lawyers to bring a class action suit to force agencies and organizations that's supposed to do things to do what they're supposed to do. But most importantly, we need jobs. Everything I've heard today is we need to make sure that people have jobs, and unemployment is directly linked to child stunting. So we know that it's cheaper to save a job than to create a job. Doesn't mean we don't create jobs. It means we have to do both. We have to save the ones we have because they already feed people. And then I think there are these important issues of linking food security and food access, helping people to get the right access at the right time. So I think there's sort of a 7-point plan that's starting to develop here of the most important things we can do, and that could almost be an agenda for the National Task Force. And Dr. Mabaso made a very important point. We don't need to throw more money at the problem. We need to do things because poorer countries than South Africa have made more progress than South Africa. We need to get a little bit of our national competitive spirit into solving the child stunting problem. And that's what I want to propose, is that we need a national task force with 7 simple things to be done straight away and keep that focus in front of our people at all times.
Dr. Weger, Dr. Mabaso, as we're wrapping up today's discussion, would you also like to comment on this and how you see it playing out, and how do we make this work by 2030? It's not so long; it's 10 years, but yeah.
Yeah, absolutely. Sorry, Ma. Sorry, thank you. Absolutely, Dawn. I mean, I think the employment one is is critical. I mean, sometimes we can create elaborate programs and sort of complex schemes to solve things, but actually people can solve a lot themselves if we give them access to the resources. So many of us who've raised children and had a job didn't go through a fancy counseling session with them. We didn't necessarily have massive interventions. We were just able to have access to some money that allows us, because it's not often that parents don't know that giving, spinach and some meat, a little bit of chicken, etc., is good for the child. It's that they just can't afford it. And the baby stops crying when you give them pap. And that's what they can afford. So I think jobs is going to definitely take us partway there. But I think we need to think a little bit more innovatively around how we reimagine solving unemployment going forward. Because as Mark said, COVID, we were already sort of on the edge, on the precipice, pre-pandemic. And things don't look like they're going to get much better. And in fact, with the potential second wave and people's resources, the sort of little buffering they have now gone, things can get a whole lot worse. And I mean, the NIDS-CRAM that Mark spoke about suggests that child hunger has doubled as a result of the pandemic. So they think it's back to sort of the 2008 crisis levels, if not higher. So we need to be smart about how we build back. And so, double duty interventions. So, I mean, I mentioned about social enterprising, so social franchising, and we need to think smart around jobs that both address social ills, like equipping a workforce with skills for ECD, because we know from the literature that, yes, stunting is, for the most part, casts a long shadow on children's lives, but that if you can mitigate some of the impact through early learning, books, reading, bonding with children, singing. Children are resilient. So, I mean, we talk about this 1 in 4. This 1 in 4 is walking around on playgrounds, on the streets, kicking a ball. We can't write them off. So, so let's think around how we reinforce the ECD workforce. We're doing mom and baby groups. There's lots of social, innovative types of enterprise that we need to thinking smarter around, because a lot of our programs are like cleaning the highway and picking up garbage, and that doesn't equip you as the young person with any kind of skill, but you're taking some, and it's not a major societal ill, and then I think, we pushed for this. We literally wrote to almost all the big retailers during lockdown, and they all sent us their sincerest regrets. But they, in a crisis, we do need to see private sector come to the party. So we identified 10 goods of food. So amasi, legumes, tinned pilchards, really basic stuff. And we had nutritionists look at this. That would be a cheap basket of food that if for a period retailers, and we suggested the hard lockdown when we knew that people were suffering, could remove markups just for a period or even freeze, because I think the Peter Maritzburg Economic Justice Group shows that prices have actually, as Mark said, have gone up. So why don't we protect a basket of foods for a period? Like let's get corporate South Africa to get behind this as well, because I think it's government has a huge role to play, but private sector can make a difference as well. So I think we probably need another session, Dawn, because there's a lot of ways that we can start shifting the needle. But certainly, there's some quick wins that we can start implementing and put into the 7-point plan.
Dr. Mark, in closing, would you be supportive of a national task force? I love the engagement coming through on all the platforms, and there certainly is an appetite for it from the public tuning into this webinar.
Yeah, certainly. I think it would be great. I mean, we need more attention given to this issue. It's something that even the policy, as I said, adopted in 2013 called for. So we have a government policy that says it should be there. So that's one of the first things that could be implemented if we're pushing for implementation. But we know structures don't solve every problem. So and we know that it can just be more meetings. But I think I'm encouraged a bit by how the National AIDS Council, at least when it had the right leadership, combined with the right political support at the highest level, has made a serious difference. So if we have a task force, but we also need to make sure this has got teeth, that it has the right kind of support at the highest levels of government and of civil society. So I think we need much more communication around what stunting is and the impacts it has, and we need to keep up that communication. So no one can go through school without knowing it, or through university, or sit in an economic development discussion without hearing about it. I think we need champions from different sectors who champion this. And this has been worked on internationally, where there's certain international champions. I think we can do more to have champions in South Africa that profile this issue. I love all the sort of suggestions and practical interventions that Kopano is talking about and that she's also driving and doing. So I think we should push those. And of course, I'm going to still argue that we need this wider food system approach. And that's where I get, a bit cautious about some of the corporate involvement, because there are very strong vested interests. There are profits. And these companies, even where they do a little bit of good here and there, and I've been in the discussions with them, I've been at the table with them, and you get to a certain point where it says, well, we have to serve our shareholders. At the end of the day, we have to get returns to our shareholders. And that tends to override some of the real serious changes we need. But I'm just raising that as a caution. And then the government obviously needs to come to the party. But and as I said, it's encouraging. Some things do work. The NSNP does actually largely seem to work. Let's celebrate some of that and say we could extend that. It's possible, in the sort of all the good reasons we have to criticize the government. But also they don't seem to even promote some of the good things they do very well. But then that's where I tie those interventions to food system change. We're spending 7 billion rand a year on food as the government for our children. Now and we know at the beginning of the year how much we need, what vegetables, what fruit we need. Why are we not sitting down with our black farmers and saying at the beginning of the year, what can you deliver? I mean, it's a secure market that, could work. So again, we can link up some of these dots and we can create greater sort of value and benefit out of them. But we're going to need change. I think we've got to start with building on what people are already doing. Build on what street traders are doing to create jobs for themselves and make food available. Build on those black farmers that are succeeding instead of having debates about whether everyone wants to farm or not. Of course, not everyone wants to farm. Of course not. But support those who do and who are farming. And I just find it amazing that I sit with black farmers and they're all normally smaller scale. I remember one woman farmer in Mpumalanga and I said, small farmer. And she said, I'm not a small farmer. I've got 22 hectares. And respect to her, she farms and she sells to supermarkets, she sells to others. But the perspective to me was interesting. The thing about her and so many other farmers I talked to that's interesting is that she's got no assistance from government. When she tries to get assistance, it doesn't somehow fit with her. So we have government programs that miss those farmers who are working and succeeding. We've got to bring that together. So definitely build on what people are already doing. We can learn from including movements, Food Sovereignty Campaign, and others that are pushing for changes in our food system, and international initiatives. Next year, there's the UN Summit on food systems, and because they've realized at that great level that we have to take this food system approach. So that is a big event for next year. Let's contribute to that, and let's bring learnings from that back to South Africa as well. We need many approaches. And we need to generate more energy around it, and certainly communicating more on it and getting some champions would be some way to start.
We cannot close off today's discussion without getting a last comment from you, Francois, and then we'll wrap up.
My first comment on the last comment is Dr. Mabasu for chairing the National Task Force. But equally serious, we need to be inclusive. We need to take everyone along with us. And I think Mark makes this point, Dr. Wegerup makes this point very well, to say it's not necessary to exclude certain farmers. It's not necessary to exclude the private sector, but it's also necessary to include those who are currently not included. And for me, this whole thing has outlined so beautifully that can be done today, not even tomorrow. We can start those things today. But also let's address the systemic problems that Dr. Wegerup has outlined so cogently. And by taking the urgent steps today, the necessary steps tomorrow, and working together in the National Task Force, we can end child stunting. And I believe that from FairPlay's perspective, and everyone's perspective, this is what we are trying to get done today. And perhaps we should all call for that tomorrow on World Children's Day, is that could be the platform from which to launch this effort.
I think there's a very clear call to action there from Francois. And that definitely, on that note, we will wrapping up today's session. It's been really fascinating learning and understanding child stunting in South Africa more clearly. It has definitely been an eye-opener for me and many of the people that have been engaging with us today. I'm looking forward to taking action in this regard. And also, I think in South Africa, we have this nasty habit of creating great policies, but we don't always see it through and action it. So it's time for action now. And we do owe it to the children of this country.
And I'm sure, Dawn, that the people participating in this webinar from all over the country are ready for action. We owe it to the children of this country. We simply cannot allow that 27% of our nation's children are stunted. Thanks for attending this webinar. I see at the moment on Food For Mzansi's page, more than 200 people watching this live stream on Food For Mzansi's website alone. And I know people are coming from all sorts of places, Facebook, Twitter, you name it, from both FairPlay and Food For Mzansi. So thank you for taking an hour of your time for this important issue. Francois Bird, the founder of the FairPlay movement. Fascinating, love your insight, and looking forward to action, Francois.
Absolutely. Thank you, everyone. Goodbye.
Dr. Kapano Mabasa, the Executive Director of the Grow Great campaign. Thank you, Kapano. What an honor.
Thank you, Ivor and Dawn. Yeah, wonderful discussion. I do hope we can take some of what we've discussed here forward.
Dr. Mark Wegerer, I'm a big fan of the circular economy, so I really enjoyed your contribution as well.